Most people worry about their blood pressure being too high. But what many people don't realize is that blood pressure that's too low can also be a problem, especially when it drops suddenly. So before we go any further, let's quickly talk about what normal blood pressure looks like. For most adults, a healthy blood pressure reading is around 120 over 80. When it drops to about 90 over 60 or lower, that's considered low blood pressure, also known as hypotension. Now, sometimes blood pressure can drop very suddenly, and that can happen for a number of different reasons. But when it does, the symptoms people experience are often very similar. You might start noticing things like feeling dizzy or lightheaded, your vision getting blurred or changing, feeling cold and clammy, sweating heavily or suddenly feeling overheated, nausea, or even vomiting, a ringing in your ears, a headache, feeling anxious or stressed, or just weak and wobbly when trying to stand. So, what should you do if this happens? In this video, we're going to go through 7 simple ways to help raise your blood pressure if it drops too low. First, lie down. If your blood pressure starts to drop and you begin feeling dizzy or lightheaded, one of the quickest things you can do is simply lie down. When you're standing, gravity pulls blood down toward your legs. That means less blood can reach your brain for a moment, and that's often what causes that dizzy or faint feeling. But when you lie down and your body is flat, blood can flow back to your brain more easily. Because of that, the dizziness often improves pretty quickly. Sometimes when blood pressure drops suddenly, people may faint. This is called syncope. When that happens, being in a horizontal position helps blood flow return to the brain more easily. So if you start feeling dizzy, try moving from standing to sitting first, and then lie down if you can. Changing your position can help restore blood flow to your brain and make fainting less likely. And if you do faint, being closer to the ground lowers the risk of injury. Try to stay away from stairs or anything you could fall onto until you feel steady again. Next, stay hydrated. One of the simplest ways to help raise low blood pressure is to drink enough fluids. Your blood is mostly made up of water, so when you're dehydrated, there's less fluids circulating in your bloodstream. When that happens, your blood volume drops, and that can cause your blood pressure to fall. Think of it like a garden hose. If only a small amount of water is coming from the tap, the pressure in the hose will be lower. The same thing can happen in your body. By staying well hydrated, you help keep your blood pressure more stable and your body feeling more balanced. Another way to give your blood pressure a quick boost is by using your muscles. If you're standing and start to feel dizzy, try crossing your legs and tightening the muscles in your legs, abdomen, and glutes as hard as you can. Hold it for a few seconds, or until you start to feel steadier. Another option is to interlock your fingers and push your hands together. Then tense your arms and try to pull them apart. Again, hold it until you notice a difference. These exercises work because contracting your muscles squeezes the blood vessels in your arms and legs. That helps push blood back toward your heart and brain, giving your blood pressure a quick boost and helping you feel more stable. Compression gear can help too. Wearing garments like compression leggings or an abdominal binder can actually help raise low blood pressure. They gently squeeze your body, improving circulation and helping blood flow back to your heart. If you start feeling a bit lightheaded at home, putting on compression gear can help prevent a sudden drop in blood pressure. And if you tend to have sudden dips, it's smart to keep some handy, in your car, at the office, or in your bag. You can also give your blood pressure a little lift with coffee. A cup can give it a quick boost if it starts to drop, but it doesn't work the same for everyone. How much coffee you usually drink, your genetics, and other factors can all make a difference. If you're the type who drinks coffee by the pot every day, it probably won't be a reliable way to raise your blood pressure on the spot. Besides fluids, muscles, compression, and even coffee, your environment can also affect your blood pressure. When you're feeling hot, your blood vessels open up, and that can slow circulation. blood can end up pooling in your legs instead of getting to your brain, which is why you might feel lightheaded. If that happens, just move somewhere cooler and let your body temperature drop a bit. And while you're at it, have a sip of water too. It helps keep your blood pressure steady. And finally, try to reduce your stress. We've all seen someone faint after a sudden shock, intense grief, or even just the sight of blood or needles. This is known as vasovagal syncope. It happens when the body overreacts to certain triggers, causing your heart rate and blood pressure to suddenly drop. When that happens, less blood reaches the brain, which can make you feel dizzy, or even cause you to faint. If you start feeling overwhelmed or lightheaded, try to sit or lie down right away. Then take a few slow, calming breaths to help your body relax. Simple techniques like box breathing, 5-finger breathing, or 4-7-8 breathing can help steady your breathing and calm your nervous system. These small steps can help your body regain balance and lower the chance of fainting. If you found this video helpful, give it a thumbs up and leave a comment below. And don't forget to subscribe to Blood Pressure Healthcare for more tips on managing and maintaining healthy blood pressure. Stay healthy, and we'll see you in the next video.